Hello everyone, welcome to Notes Gurukul. In this video, we will study about the dental pulp. In the image, you can see the tooth anatomy. So, a tooth is comprised of enamel, dentine, pulp, cementum. So, amongst the different parts of the tooth, only the enamel is the non-living part, whereas dentine, pulp and cementum are the living parts of a tooth. So what is dental pulp? Pulp is a soft mesenchymal connective tissue that occupies pulp cavity in the central part of the teeth. So what is pulp cavity? The entire space that is occupied by pulp is composed of a pulp chamber and a root canal. So this pulp chamber and the root canal together form the pulp cavity. The pulp chamber is found in the coronal portion of the tooth, that is the crown portion of the tooth, whereas the radicular pulp or the root canal is present in the root portion of the tooth beneath the cemento-enamel junction. So the pulp cavity is divided into two parts, coronal pulp and radicular pulp. The part above the CEJ or the cemento-enamel junction is the coronal pulp, whereas the part beneath the CEJ is the radicular pulp. Now let us see the coronal pulp. Coronal pulp is the pulp occupying the pulp chamber of the crown of the tooth. In young teeth, it resembles the shape of the outer dentine. The coronal pulp has 6 surfaces. It has an occlusal surface, it has a mesial surface, it has a distal surface, buccal surface, lingual surface, and a floor. The pulp horns are projections of the coronal pulp that extend into the cusp. So as you can see, this is the pulp horn. So these are projections of the coronal pulp that extend to the cusp. So this pulp constricts at the cervical region where it continues as the radicular pulp. Now let us look at radicular pulp. The radicular pulp is the pulp occupying the pulp canals or the root canals of the root of the tooth. In the anterior tooth, it is a single radicular pulpal canal, whereas in the posterior teeth, there are multiple radicular pulpal canals. The radicular portions of the pulp is continuous with the periapical tissues through the apical foramen. As age advances, the width of the radicular pulp is reduced. What is an apical foramen? The pulp cavity terminates at root apex, a small opening called apical foramen. So as you can see, this is the root canal or the radicular portion of the pulp, and here is the apex of the tooth. So the pulp cavity terminates at the root apex in a small opening. So this small opening is known as the apical foramen. The radicular pulp continues with the connective tissue of the periodontium through this apical foramen. Wide open during development of the root. This means that during the developing stage of a tooth, that is in an immature permanent teeth, the apical foramen is wide open. So in an immature permanent teeth, we call it as open apex or a blunderbuss canal. The open apex refers to the absence of sufficient root development to provide a conical taper to the canal, and it is known as a blunderbuss canal. Blunderbuss means that the canal is wider towards the apex than the cervical area. The completion of root development and closure of the apical foramen occurs up to 3 years after eruption of tooth. Now let us see about the accessory canals. So the accessory canals, they lead laterally from the radicular pulp into the periodontal tissue. They present in the apical third of the root sheath cells. They may also be present at the furcation region. So here you can see these small canals that are lateral extensions of the radicular pulp. These lateral extensions of the radicular pulp are the accessory canals. Okay, they extend into the periodontal tissue. Now let's see the histological zones of a pulp. So from outer to inner zone, the outermost zone is the odontoblastic layer. The innermost zone is the pulpal core. So first of all, let us see the outermost layer, that is the odontoblastic layer. The odontoblastic layer lines the outer pulpal wall and it consists of the cell bodies of odontoblast. Secondary dentine is formed from odontoblast. The next zone after odontoblast is the cell-free zone or the zona veil. They have fewer cells than odontoblastic layer. Nerve and capillary plexus are located in the cell-free zone. So as the name suggests, there are fewer cells. That's why it is known as a cell-free zone. After cell-free zone, we have the cell-rich zone. So as the name suggests, it is rich in cells. So there is increased density of cells as compared to cell-free zone. And there is also an extensive vascular system. And coming to the innermost zone, that is the pulpal core, that is the core of the pulp. It is located in the center of the pulp chamber. It has many cells and an extensive vascular supply, and it is similar to the cell-rich zone. So in this diagram, you can see the histological zones of pulp. So this is the dentine. This is the odontoblastic layer or the outermost layer. You can see numerous odontoblastic cells lining near the dentine and they produce secondary dentine. Okay. Then we have the cell-free zone. Here fewer cells are present. Then again we have cell-rich zone. A lot of cells are present here. And here we have the core of the pulp. The various cells found in the pulp are odontoblastic cells, fibroblastic cells, undifferentiated mesenchymal cells, and defense cells. Coming to functions of the dental pulp, the first and the most important function is inductive properties. It helps in differentiation of the oral epithelium into dental lamina and enamel organ. So it helps in the formation of enamel and dentine in a growing tooth. It helps in dentine formation. It maintains the vitality of dentine by providing oxygen and nutrients to the odontoblasts. It responds to irritation by producing reparative dentine. Also, it has some protective function like recognition of stimuli such as heat, cold, pressure, chemicals, because it has sensory nerve fibers, mainly C-type nerve fibers. These are the various functions of dental pulp.